Okay, Angel. So whenever you're ready, you can start with Dr. Lorenzo Gonzalez.
Yeah, for sure. I can start right now. So hi everyone that's on the meeting. My name is Angel. I'm a promoter with Andale que Esperas and Latino Health Access. I'm gonna be the moderator for today's meeting and today's town hall. And we just want to give a quick mention that this meeting is going to be recorded and it is going to be in English as well. So we just want to mention that to make sure that if you're on the meeting or if you're watching, just to make sure to know that you are being recorded and to not share any like really personal information to make sure we're not broadcasting that or we're not sharing any type of information. Um, yeah, so good afternoon, everyone. Welcome to Pregúntale al Doctor. So, yeah, just to explain more and to introduce Dr. Lorenzo Gonzalez. Um, you're born, or he was born and raised in Anaheim, and you immigrated. Your family immigrated from Michoacan in Jalisco, and you obtained your doctorate in medicine from UC San Diego. You graduated from the Prime Health Equity Program, and you're also the chief resident for Harbor UCLA's family medicine residency. So if you can just introduce yourself and say hi to everyone that's on the meeting and who's watching. I'm not sure we can hear you.
How about now?
Yeah, we can hear you.
Awesome. Well, saludos from the clinic. I'm gonna probably, work really never really ends, especially during a pandemic. I would say my name is Lorenzo Antonio Gonzalez. I'm a family medicine physician. I just finished my residency, and one of the things that I like I'm passionate about is community health, community medicine. I actually was an intern back in the day with Latino Health Access, and they're the ones that really like envision that I can become a doctor, I can be a physician leader, and my goal is always to give back. So that's why I'm here. I work out of Harbor UCLA. Harbor UCLA was the hardest hit hospital on the west side when it came to COVID. So, I was in the inpatient, I worked the ICU, and I just recently came off this surge. So I have an intimate knowledge of what this looks like up in front. A lot of people passed away. A lot of people are going to be battling long COVID, and we don't really know what that looks like in the future. But the number one thing, and we continue to push forward, is people need to social distance, people need to get vaccinated, and when applicable, use the right medications. So, I hope to answer as many questions as y'all have. I never lie to an audience. So if I don't know something, which is possible, I'll let you know that I don't know. I'll go figure it out. I'll go do my research and then come back, because COVID is ever changing. Every day there's something new. So therefore, I think, it's hard pressed to really get everything all at once. So I think that's a pretty good intro, and then I'll bounce it back to you, Angel, and we'll continue going.
Yeah, thank you, Doctor, for introducing yourself. We also want to thank you for taking the time out of your day to be on this meeting and volunteering your time to share some critical information about COVID and answer questions from the community. And just to start it off, we're going to have other youth promoters, my coworkers, who are going to be asking questions. So it's going to be Karen, Litzy, and Maria. So they're going to be the people asking questions. We're also going to be taking questions from Facebook Live. So if you have any questions, any comments, feel free to put them in the chat. We'll make sure to get to them and to answer them and to ask you, of course, so you can get your answer and so these people can get answers to the question. So yeah, I'm going to pass it on to Karen to ask the first question and to get this started off.
Okay, hello, I'm Karen. And a reoccurring question that we have frequently seen is, will the vaccine cause any long-term effects on someone's body?
Yeah, so the long-term effects of having a vaccine is really non-existent. The only real thing that's really, I would say, worrisome is this idea if you have an allergic reaction, right? And even in those cases, we're willing to actually have those injections done inside the hospital if the folks really need it. There has been folks that they're like, I'm allergic to the vaccine, but I still want the vaccine. So we'll be able to control in a control setting, such as the hospital, be able to administer it. But that's a rare case. I've never experienced that. Outside of that, the way the vaccine works is kind of just like giving a blueprint to your body, and then that blueprint kind of dissolves, right? So it's not going to stay in. It doesn't alter the way your body changes anything. It's just really showing it how to identify the virus. So there is, outside of those, common fevers, chills, just feeling a little bit down, having those body aches. Some people get it worse than others. The vaccine in itself is not the cause of long-term effects. Now, some folks have like the myocarditis or an inflammation of the heart, super duper rare, right? Some folks have like, they've talked about these like thrombosis or like clots, super duper duper rare. And we're talking about like not even like a speck of a percentage. So overall, we all in medicine talk about risks and benefits, and the benefits is so much better that the recommendation is to vaccinate. Now, the opposite about COVID is not true, right? Like we know that's causing damage to your body that is long-term effects. So even if you feel good now, we cannot guarantee you that you'll feel good in 10 years, 15 years, 20 years, 30 years. And we've had experience with other diseases that have behaved like that. And the one that comes to mind is polio. So folks that got polio felt fine. Later on in life, were having much more difficulty with walking and their neurological system because of the polio vaccine. The polio virus, not the vaccine, the polio virus, the infection.
Yeah, thank you for answering that, doctor. And to kind of follow up, there's been some people who are trying to get vaccinated and who might have illnesses or diseases such as cancer, diabetes, HIV. Is it kind of the same situation? Will it have an effect, or is there some kind of risks of getting the vaccine if they're kind of in that group?
Those are the groups we actually want to protect the most. Always think of the vaccine and these antibodies as a layer of armor. It's a way of protecting your body. So when the virus comes in, your body's already rejecting it and pushing it out. So those are the folks that there is no contraindication. And there's no reason why these people should not get it. They're actually the ones we want to actually highlight, spotlight, and find and give it to them, because they're the ones that are going to probably benefit the most. The only difference I would say is that if some folks, what we call have immunosuppression, right, their immune system is lower, those are the folks that actually will need more vaccine. So it's just like the 2 doses plus the booster is just not enough. Those are the folks that probably will need 3 regular vaccines, then the booster. So it's just, again, this idea is like those people are at risk. Therefore, we should be giving them more armor, and that more armor, that more protection is with the vaccine.
Right. And to go a little bit more into the vaccine, I know you mentioned kind of it's kind of like a blueprint. We've also seen in the community that people have been saying, there's some sketchy things about the vaccine. For example, the ingredients, how it's made up. Can you go a bit into more of like the basic science behind the vaccine and kind of, if there's actually anything that's sketchy about what's in the vaccine, or is it kind of a myth or a conspiracy?
Those are some like big words that might have a lot of charge into them, like this conspiracy, and it might be true, but I'm going to tell you, inside of this vaccine, there's salts, there's sugars, there's fats, and then there's the what we call the nucleic acids, right? In this case, at least for the 2 ones that are like the most popular, your Moderna and your Pfizer, those have RNA, which is similar to the DNA. And we can definitely go into the weeds on why it's important, why it's different than the DNA and all that. But at the very basis, you have some fats that incorporate, just make the capsule around the RNA, which is the RNA is the blueprint. That's what we're really trying to get into your cells, into your immune system. And that's the fat. And then we have some salts and sugars that are able to stabilize it, because the stabilization is important, because these fat things don't really want to stay around. One of the main ingredients well, no, I wouldn't say main ingredients. I would say the one that's most commonly and probably the one that folks have an allergic reaction is called the PEG, the polyethylene glycol. That one is in a bunch of things. And therefore, we always tell folks, if you're allergic to that, you already would have known, because you would have interacted with it in your day-to-day life. And most of the folks are like, I've never heard of it. So that's a good indicator, but we're always prepared. We're always ready. We got our EpiPen just in case, because we know it can happen. And in medicine, nothing's 100%. There's always that small percentage. So we got to be prepared for that as well. The big thing is this like little fat cell, right? This what we call a micelle, or it's a capsule that is made out of fat that will get integrated into your immune system cells. And then they will send that message, not into where you keep your DNA, and your DNA is what you keep. It's como tu herencia, right? It's your hereditary. It's what you get given from your parents, and that doesn't get touched. It goes completely outside of that, and it starts building kind of like the sensor that's able to sense and then neutralize the virus. So again, just to repeat, the RNA is your nucleic acid. You have your fat, your sugar, and your salt. And a lot of these things, you find them in many products, such as like makeup, other medications, really much like day-to-day stuff.
Right. Thank you. So kind of to reiterate, the vaccine is kind of made up from a different amount of components, sugar, some other things that can be found in our day-to-day products. And there's a lot of things made up to it, but for the most part, it's safe and reliable.
I would go one step further and go like highly safe and reliable. Not even for the most part, highly safe and reliable.
Great. Thank you for that clarification. And I'll pass it to my coworker, Alex, who's going to ask you the next question.
Hello, everyone. My name is Alex. So within the youth community, many people are saying that the vaccine can affect your probabilities of having children in a negative way. How true is this, or is it not true at all?
Absolutely not true. There's two different types of cells, and the ones that make you, actually be your reproductive cells don't come into encounter with this at all. And even if they did, it wouldn't alter them at all. So there is no truth to that aspect. However, there are new treatments out there that have been known to have changes in these type of cells. So that's why it's actually quite interesting that, the idea that folks are not willing to take a vaccine, but take a treatment that has that potential side effect. And therefore, always it's about the game of let's not get the let's not get the virus, let's not get infected. I think this idea that you're presenting, that it can have some issues with you having children or being able to reproduce in the future, that is completely false. And then there were some concerns for some pregnant individuals. And we've actually been able to look at that already, and there's studies that show that these vaccines actually have no impact on that.
All right. And there have been some cases where, for example, someone gives birth and maybe the mother might have had COVID and then the child gets COVID. Is there any kind of risk of getting the vaccine if the baby after birth has gotten COVID?
So, I mean, if the mom has COVID and she's giving birth, this is something that's happened. I've actually been around folks that taken care of this exact case, and it's been quite challenging, especially for the adult. But overall, I think the thing is, like, if COVID is in the mom, anyone in that room is potentially there to be exposed, and they will get infected. And there's definitely been cases where, it can be transferred down to the child as well. The good thing is that we want folks to be able to get vaccinated and breastfeed and be able to give those antibodies to the babies. This is something that our body normally does. This is why we promote, having breastfeeding over formula feeding, being able to give the best chance for the child. So if you're thinking about like trying to protect your child, and right now we know that there is no vaccine for children under 5. We should be able to protect them, and we should be able to breastfeed the ones that are breastfeeding, so we can able to transfer as much protection as we can.
Right. Thank you for clarifying it. I'm going to pass it to my coworker Maria, who's going to move us on into our next question.
Hi everyone, I'm Maria. And for my other question, it would be, I know people that have gotten the vaccine and are still getting sick. Is that supposed to stop you from getting COVID-19?
Nah, it's not. So I think we all wish it did. Yeah, even in the beginning, it was never like foolproof that we were gonna be able to stop the COVID infection. But we did hark on this, on the proof. It's, the proof was there that the folks that got vaccinated were not dying, and the folks that got vaccinated were not getting with a high burden of COVID, like a really high level where the disease is really bad, where the point where you have to get intubated, where the point where you have to have like so much oxygen that without it, you would probably perish in moments. And I've seen that. I've seen those effects, and there is cases where folks got vaccinated and needed to get intubated. And a lot of those cases, they're like immunosuppressed because they have cancer or because they have a transplant. Those are a lot of those cases. And again, like I said, medicine is never 100%. But when we have something like, we will not have severe COVID, but you may get still infected. You still will show positive on the test. You might have a scratchy throat. It might hurt. You will have a cough. All of that, knowing that your body has the antibodies, it is pushing back against the virus and making sure that you are not going to get as sick as they would normally have been sick. In personal connection, my whole family, I've been able to get them vaccinated. And it started with me first. I had to be vaccinated. And then, they were vaccinated. And even still they obtained COVID, they got COVID. And I'm just so happy, so happy that they are still safe. They recovered well. We'll see what the future has in hold for them, because, that long COVID, or it's still up, that's up for debate on how we're going to be able to treat that. But ultimately, I'm very happy they got vaccinated. And that's why I'm here, because I know that we're talking to gente that is very similar to my family. And that's why this touches me really close to my heart, because we have to make sure we save as many folks as we can.
Yeah, total agreement. I think one of the things that you were going over was the common symptoms after you get the vaccine, such as maybe having a fever, having a sore throat, or a scratchy throat. Can you go over some of the symptoms that might cause you to maybe pay a bit more attention, or that might cause concern, or some unusual symptoms for the people?
Yeah, so we always tell folks, and I remember being a part of the Latino Health Access Initiative when we were going out into the community and vaccinating folks. We're like, if you start feeling a headache, if you start feeling some fever, some chills, take a Tylenol. And take a good amount of Tylenol, right? Like, folks are like not taking enough Tylenol. They'll take like one pill and then be like, I took it once a day and I don't feel that good. I mean, like, I normally tell folks to take almost as much as you can and still be safe with. And, and you can always talk to your doctor about that, or you can read behind the label. It'll show you what's your max dose. And Tylenol really works well. Ibuprofen or the rest of the NSAIDs really, really work well. The thing that I get worried about when someone gets, vaccinated is, especially in the younger and the youth, is, and especially in like males, is that they will develop some sort of like chest pain, and they'll have difficulty breathing. And if that doesn't get improved, and if that actually gets worse, I highly advise going to seek some professional help, going to the hospital, going and talk to your physicians, because we want to make sure that we address the issue of the myocarditis. It's super rare, super rare. We had one here at our hospital, and therefore, it does happen. But again, it wouldn't stop us. We actually decided to vaccinate that person again after we all talked together, after we all talked and as a big family, because we knew that the risks and benefits. And then the other one is, difficulty breathing is a sign of having a severe allergy. And again, going back to this idea that really the only reason why you shouldn't get vaccinated is because you have a severe allergy. And there's even people out there that decided to get vaccinated, be in a hospital setting, because they saw that the benefit was greater for them.
Right. And to go a bit more on, as you're explaining about the symptoms, maybe what someone should do if they're having the symptoms, is there anything that a person after getting vaccinated shouldn't do or shouldn't like take a certain medication? Is there anything sort of that?
We always say, if you don't have symptoms, don't take anything, right? Like, but if you have symptoms, if you have the headache, you have the fever, you have the chills, you got the bone and the muscle aches, take some ibuprofen, take some Tylenol, anything over the counter. You don't have to go find anything expensive or fancy. None of that is going to impact your response to the vaccine, and that's the most important part. It's like, we want to make sure that you get vaccinated so you can build those defenses. But after that, for me, it was a really sore shoulder. It was kind of difficult to kind of work a little bit, but it was fine. There's nothing that you can't do after you're vaccinated. But if you do have some symptoms, take your medication. If you feel fatigued and tired, take the night off. You'll feel better in the morning. Some people might take 2 days. But again, I always tell folks, remember, take the medication as the medication is supposed to be intended. Read the back of the label, see what the doses are.
Thank you. And just to reiterate what Dr. Gonzalez was saying, is to, if you have these symptoms, common symptoms are expected. I think fever, those are common, and you can take medication. Tylenol is fine. And so to move on to our next question, Litzy is going to be asking it. So go ahead.
Hello, my name is Litzy, and what I'm gonna inform is a statement that we've heard frequently throughout the youth in our community, and it's I've already had COVID and I don't need to be vaccinated because I can't get it again.
I would say this statement has been changing since the beginning of the pandemic. And at first, we didn't really have a lot of data. We didn't really have something to really kind of guide us moving forward. So we were very conservative in the beginning. So in the beginning, we're like, you got COVID, you need to be vaccinated as soon as possible to protect you, right? And I don't think that part has changed. But the thing that we are recognizing now is this natural immunity that you get from the infection. And we knew this was going to happen, right? We kind of understood this is how our immune system works all the time. But what the data showed, and this is the important part, and I think this is the part that kind of gets missed a lot of the time, is that what's better than just natural immunity, which is just getting COVID, right? That you got COVID, you survived it, you're good, is when you have COVID plus the vaccine. That was the best. So the combination is the best. So now you have to think about it. How am I going to get, not that we want to, but how am I going to get to that? If that's the goal, you have two roads, right? You can either get COVID while you're unvaccinated and then get vaccinated, or you can get vaccinated and then get COVID. So that aspect is probably the preferred method. And the reason why I say this is because if you're going to go out to battle, if you're going to go out to war, you want to have that armor, right? That immune system ready to roll, because it's going to be able to identify the enemy. And that's the part where I wouldn't want to go into that war, that battle, without any armor. So think about it that way. So why we want to make sure people are vaccinated when we know that natural immunity does work is because there's something better, which is natural immunity plus vaccinations. And we don't want you to get the complications of the infection, right? We don't want you to have your lungs to not be at its full capacity. We don't want you to have, dizziness spells. And we don't want you to have the inability to taste. We don't want you to have headaches that you don't know why they're being caused. We don't want you to have pains in your body and we just don't have an answer to it. These are the things that people are having, and we're talking about like a year after COVID, right? So we want to avoid that. And if we can minimize it, knowing that hopefully you don't get COVID, but in the case you do come in contact with them, you have some barrier of defense. So this idea, right, going back to your question, I don't need to get vaccinated because I already got COVID. No, get vaccinated because that's even better protection. Moving forward, variants, right? A reinfection, how long your defenses, how long that armor stays inside you, that's all up for grabs and all still hasn't necessarily been worked out. So we got to be careful. And with that carefulness, it's best to be vaccinated. And if you already got COVID, get vaccinated. But hopefully we can get you vaccinated before you get COVID. And the thing is we vaccinate you, no COVID.
Right. And so kind of the main point is, get vaccinated if you can, to make sure that we're keeping everyone safe and to make sure that we're trying to do our part and everyone is doing their part and getting back to a normal world, a normal place where, we don't have to worry about getting COVID, being hospitalized. So we actually have a question from the Facebook live chat. And the question is, that they've heard the term herd immunity being like kind of thrown around. Can you kind of like clarify what that means?
Yeah, herd immunity is like the holy grail of public health, right? It's kind of this idea that what we really want to kind of achieve as a society. And this is the idea that if there's enough people that are not getting infected because they have a level of immunity, either if it's vaccinated or if it's infected, or hopefully it's just vaccinated and not infected, but there's enough people that stop that virus to go to the next person, then that virus ends up dying within that person it infected. It doesn't spread to the other people. So conceptually, think of like a herd of buffalo, right? If there's only one infected buffalo, but none of the other buffaloes can get infected, everything just ends up dying with that one animal. But if everyone else is susceptible, then especially when the transmission rate, so that means you can get infected really easily, that part is where everything got spreading. And that's exactly what happened roughly 2 years ago when this was first hitting us at home, is that everybody was so susceptible. Nobody had defenses, that we really had to spread out, like physically spread out, to make sure that that virus couldn't get near us. So now that we have these vaccines and that layer of protection, we're saying we can come in a little bit closer because we know that that transmission is not going to be as high as it was. And if it's low, if it's actually, there's an actual number, if it's less than 1, then in time, that transmission is actually going to stop. And that's how we stopped polio. That's how we almost stopped, the measles. But there's folks that don't believe in vaccines, which makes it come up in certain areas. It is literally like I said, the way we try to control diseases. So there always is like, what's that magic number, right? And there was estimates in the past, and when this first started, that said, if we can get 80% of the people vaccinated, we'd be done with this within a year. We'll be back to normal. But we haven't been able to do that. So we allow the virus to continue to live. And let me tell you the secret. This virus It wants to live, right? And it's a little, viruses aren't actually alive, but if you think about it, this virus actually wants to continue to be alive and move forward and be able to infect as many people because it wants to continue to exist in this world. So we have to do whatever we can to stop it. And our best defenses now at this moment in time is our vaccine, right? If you end up getting COVID, we have some treatments now. That's a big difference from last year. And we want to make sure that and the only reason we give treatments is for folks so they can survive COVID, right? So the idea is more like we want to avoid that infection. That's still the principle. That's still where we should be focusing our efforts.
Right. Yeah. Thank you. Thank you, Dr. Gonzalez, for explaining kind of the treatments, what herd immunity is, how it's been accomplished with other viruses such as measles and polio. So thank you for clarifying that. And I'll pass it back to Karen to ask the next question.
Okay, so the next question would be is, at the moment, do we know if this vaccine is going to be an annual thing, or how often will we keep having to be vaccinated in the coming future?
I would get a Nobel Prize if I knew that. I think this is all best guess for everyone. The reason why we take annual flu vaccines is because the flu changes the way it looks roughly every year. Again, it wants to survive, right? The thing with COVID, it wants to do the same thing. And if we give it the opportunity, it's going to try to change and continue to survive. So a lot of this is really dependent on us and being able to, make sure that we stop that transmission. Now, even at the best cases, our immune cells, the ones that give us that protection, it's not always forever. And that brings up another idea as well. How long are these antibodies going to stay in us? We don't have the answer to that because it's only been about 2 years. So we'll see as time moves forward. But if you look at other vaccines, right? If we look at the tetanus vaccine, everyone gets the tetanus vaccine. You should also get it around when you're about 17 to 20. At the time you're going to college, and that's the time where you get your tetanus vaccine again, and it's good for 10 years. And we know that in those 10 years, it will give you some protection. Hepatitis B, there's been many a times that I've been seeing that we test their labs to see if they have the immunity, and we see that it's low, right? Very different for different people. So not only are we trying to figure out, did the virus change, but we also have to incorporate how long are these antibodies going to be in our body? How long are they going to be giving us that protection? Those two factors are going to determine the frequency of our vaccine. So at this point, I can't tell you if we're going to do it every year, every 5 years, every 10 years. But what I'm pretty sure and pretty certain is that we're going to be doing this, into the future, right? The frequency, not that sure. But like we already have a lot of vaccines that you need to get them multiple times. So I think this will follow that similar pattern.
Thank you. Thank you for explaining over kind of the vaccine, and answering the question to the best of your knowledge. It's kind of another question about the vaccine and what we've kind of seen as promoters, an often question that is asked about the vaccine. And we know that there's, the first dose, the second dose, the booster, and then there's kind of the difference between the third dose and the booster. Is there a difference between each vaccine, for example, the first and second between the third, and regarding the dosage? Is there kind of a difference or anything that makes them different?
The actual medicine is exactly the same. I don't recall off the top of my head if the dosage is different for the booster, but there is a pediatric dose. So for those populations, it's usually for 12 and below. And this is all Pfizer when we're talking of pediatric. That's the only one that has been currently in use for the pediatric population. But the actual active ingredient, the actual mechanism does not change at all. I think that the real big question here is that we actually need this booster. This booster is actually what's keeping a lot of people alive, especially when they go into the hospital. From my personal experience, from the patients that I was taking care of when I was in the hospital, the folks that ended up not doing well, and by that I mean dying, those are the ones that were not boosted. And then you have folks that you're like, this person is probably not going to do very well, and they're completely boosted, and you start seeing these patterns. So I think like it's incredibly important to get boosted. So if you're above 12, make sure you get boosted, and making sure that we are able to protect as many people. I'll get back to you on the dosage. I'm not the one that actually injects the folks. I'm the one that orders it. So that part escapes my mind. But I definitely want to continue to be truthful, and I'm not just going to throw out a number out there.
We appreciate you being, honest with us and giving honest answers. And so we actually have another question from the chat, which is asking about the different brands of the vaccines that are offered. And they're asking, is there like a certain difference? Is one better than the other? Yeah.
Yeah. So get the one you can get, right? Like that's the ultimate answer. I think that there's definitely differences, and there's like a big line in the differences. It's the ones that are this mRNA, using these fat cells around in order to be able to put it into your immune system. That is one category. So you have your Pfizer, and then you have your Moderna, but then we also have the Johnson and Johnson, which is using a different way of introducing the blueprint into your body. And there's a lot of studies that show that the Johnson and Johnson is effective with multiple doses. But it was also like, I guess, the promise is still the promise that you would not have severe COVID or die from COVID with just one injection. And then you're thinking about yourself, well, if it doesn't protect me as well as the Pfizer and the Moderna, para qué? But realizing that there's a lot of special populations that it's really hard to be able to get two vaccines, and having the ability to protect someone's life with just one vaccine really does help. What we're actually recommending now is that, folks can mix and match. So if you have a Pfizer, and you're already over 18, and you're able to get like a Moderna, right? If you're not part of the pediatric population, the mix and match actually does really well. And if you had Johnson and Johnson, and you're trying to get a booster for that, it looks like Moderna and Pfizer is actually a better bet to do, to add that layer of protection. So, the recommendation's always changing. I think right now, as a hospital system, we're pushing Moderna and Pfizer. But for the folks that got Johnson and Johnson, y'all did the right decision. That was the right decision. And now moving forward, we just have to get boosted. But there is a difference, right? There's the mRNA with the fat around it, and then this like different capsule, which is the Johnson and Johnson. All of this technology, we've been dealing with this technology for like decades. Like even when I was like in the beginning starting off, we were talking about mRNA.
Right. And we've kind of seen this thing of like, a person gets Pfizer and they're like, oh, Pfizer's the best, or someone's getting Johnson's the best. To ask you, which one are you? Did you get the Pfizer, if that's okay?
I didn't have an option. I got what it was coming out first, right? Because I needed to continue to work. I needed to continue to see my patients. So I got Pfizer. It was the first one out of the gate, and that's the one I got. My whole family is Moderna. And then I have a couple of folks that are from Mexico, and they got the AstraZeneca. So that's another one. You don't see that one here. It's more closer related to the Johnson and Johnson one as well.
Thank you.
There's a lot.
Question.
There's a lot of vaccines out in the world. We just see the ones that are, here in the United States.
Mm-hmm. And For the next question, I'll be passing it to my coworker Alex to ask that question.
So the next question was, we have heard of different wait times when it comes to getting vaccinated after getting COVID. What is the difference?
Yeah. So again, this goes to like this whole like COVID's ever changing, and we see data, and then we're like, let's go back and restructure our ideas because now we have data to suggest something else. So in the beginning, we'd be like, you got to wait a month, right? Like you got to wait, this amount of time. Now we're vaccinating people as soon as they're feeling better in the hospital, to be honest with you. Like even before they leave, the goal is, hey, can we get a vaccine in their arm? And making sure that, they don't have the big question is if you're feeling better, you should be getting vaccinated, right? And what does that mean, feeling better? That means that your symptoms are greatly improving. So, you have to kind of guess, well, this were my symptoms, or maybe I didn't have any symptoms. And that's the case. Once you're starting to feel better, once you're already without a fever, once, like, say, your oxygen demand, because let's say it ended up you're in the hospital now, and you needed oxygen. Once your oxygen requirements are improving, before you're leaving the hospital, you're gonna get vaccinated, at least under my watch. And your question, if I got COVID and my symptoms were mild, hey, once you're already out of quarantine, once you're feeling better, I would go and seek a vaccine. So making sure that you're as protected as possible.
Thank you. And we're talking about hospitalization and a lot about how people are going into the hospital because of COVID. Can you explain a bit more about what is the difference among hospitalization rates between people who are vaccinated and people who aren't vaccinated?
This is a huge, huge difference. So the people that we're seeing in the hospital right now are the folks that are not vaccinated by a large, large, large margin. I'm talking about that's like the overwhelmingly amount. The other smaller group is the folks that are incompletely vaccinated, right? The ones that are just like, they got one shot or they're missing their booster. Those are the smaller group. And then there's an even tinier group that even that smaller group, which it is still possible to be fully vaccinated and be fully vaccinated and still end up in the hospital. But by magnitudes, the difference between unvaccinated and vaccinated, fully vaccinated, that's a big, big difference. Numbers, it can be relative, but I would say the data definitely suggests the importance of vaccination. And this actually came out, I think, for LA County, the CDC brought out these numbers maybe within the last 3 to 4 weeks, and which really showed that November, December. So that's the part where we were getting this data that showed the success and the importance of being vaccinated. But I just want to make it clear that it is a big difference from unvaccinated to completely vaccinated.
And to kind of summarize, it's important to get vaccinated, but to also clarify, it won't stop you from getting COVID, but it'll definitely lower the chances of you being in the hospital. Is that correct?
Correct. Having COVID is not great. And if you're vaccinated, your symptoms shouldn't be that bad. But there's always exceptions. However, the goal and the reason why it's so important is because we don't want you to come to the hospital. We don't want you to be taking up one of these beds, because every COVID bed that is taken, that could be given to someone else. And we're starting to see a lot of folks that don't have COVID, that have been trying to get away from the hospital, who don't, this was huge, just a couple of weeks ago, that we're running out of space. And for the folks that have heart attacks without COVID, the folks that are having strokes without COVID, the folks that are, out in having like their diabetes completely out of control without COVID. Those people need a bed. And you can see some really crazy pictures from the first time, right? That winter 2020 to 2021. People were on the floor. People were out in the middle of the halls. People were like literally being treated in a chair. And that's what we want to avoid. So, we don't have infinite amount of rooms in our hospitals. So what really helps us is that if you get COVID, not ideal, but hopefully we can just manage it out at home with some Tylenol, with some over-the-counter medications, drink a lot of fluid, be able to do exercise as tolerated, and try to keep these hospitals up and running, because sick people are still sick people. And we need to make sure that that space is available for them.
Thank you for answering the question and explaining the importance of actually getting vaccinated to make sure that, the healthcare system and the hospitals around us aren't getting overwhelmed, and so that like people that need treatment and essential treatment can get and have the opportunity to get this treatment. So thank you for that. And to move on to our next question, my coworker Maria is going to ask it.
For the next question, we do hear a lot from our youth group ask, and they tell us we have a strong immune system, so why do we need to get vaccinated? Can you talk a little bit about that?
Yeah, so not everyone has a strong immune system. That's point number one. And a lot of folks don't really know each other's medical past or medical history, or we don't obviously disclose it, right? So that's first an assumption that everyone around you is healthy, strong immune system, right? And then the other aspect is like in medicine, we like to really work off probabilities. And one of these probabilities that I always like to, it's like, it doesn't matter, if it's a small group of people that only get really, really sick, that small group of people can be a big number if there's a lot of people impacted, right? If a lot of people get impacted. So you pick a percentage, right? Let's say like 1%. And there's always going to be that small group of people that if you think about it, well, it's not that big of a deal. It really matters to them. And it really matters to those folks' lives. And the folks that, even though they're young and strong, they can have bad luck. And maybe this virus was really bad. Especially like earlier, we had the Delta and the Delta versus the Omicron, like, which one's worse? And they're all they're different. They're the same virus, but they presented differently, right? Delta seemed to be more aggressive. It was killing more people. Omicron, much more transmissible. So it was like infecting everyone. Just when I was in the hospital, we had roughly around 5 to 10% still Delta around in Los Angeles, the greater Los Angeles area, which includes Orange County. So I would say in that component, in that aspect, it is first, we cannot assume, right? We cannot assume that everyone's healthy. The second thing, even if you are healthy, there's still a probability that you might have a severe infection. I'm about playing the odds and the ratios. And with this Omicron, now it's affecting so many people, so more we will see these cases more. So I would say, hey, don't get infected, because if you get infected, we don't really know the long-term effects. If you do get infected and you feel better, great. We still need to protect you for that next variant. And then let's not just think about ourselves. Let's think about the folks we don't know around us, right? Because we cannot assume that every young person has a strong immune system. So that would be my answer to that.
Yeah, and thank you for adding, another reason why it's important to get vaccinated and why it's important for everyone that has the chance and has the opportunity to get the vaccine, to make sure that they're protecting not only themselves, but those around them. And so we're about to wrap it up. We're asking our last questions. We obviously want to be respectful of your time, Dr. Gonzalez, because we know, you're doing an essential job, and want to make sure that we're being respectful of your time. So one of our last questions is actually from my coworker, Alex, and he's going to ask it.
Another question that we had was, even after testing negative, why do we still have symptoms?
Oh, that's a good question. So you're like, I feel like I have COVID, but I don't have COVID because I got tested. Well, I would say one thing is that, the tests, as good as they are, they can still be wrong, what we call a false negative, right? Small chance, possible. Could be you. Maybe you swabbed a little early, but if you had symptoms, it was probably the right time to swab. Second thing is, there's other things out there that is not COVID. There's a lot of things out there that are not COVID, right? We have the common cold, the other coronaviruses, right? This is just COVID-19, right? This is SARS coronavirus 19. This is the one or SARS 2, excuse me. But the flu's out there, right? We have the rhinovirus. We have bacterial infections. We have allergies, right? So a lot of things can cause you these symptoms. It's really hard for us to actually distinguish between corona and the flu. And that's where you get this idea of the flu-rona, right? Like this idea of maybe you're infected with both, maybe you're infected with one. But the idea that you have symptoms, but yet you're COVID negative, doesn't necessarily mean that you're not infected. I would repeat that test, give it a day or two and repeat it, or get a better test like a PCR test, because that might be the best way to go. And then if that's still negative, at that point, I would consider maybe I don't have coronavirus, but damn, I got the flu, or man, I got the cold, other things, right? Maybe I have allergies. So just because it's symptoms doesn't mean everything is coronavirus. And we see this at the hospital all the time. We're like, can this be corona? We should check. If not, let's continue thinking. Let's use our brain still. And like I said, there's a world out there of a lot of viruses and a lot of bacteria that want to continue to be in this world. It is a battle that we are in every day. Our bodies have figured out how to defend it. Now the problem is that there's new things coming out, such as COVID. And we have to be, now that we have all this technology, we're able to not have so many people die. That's always the point, is how many lives can we save? Because at the end of the day, that can be your parents. That can be your brother, sister, your siblings, folks that you actually love. That's the folks that we should be protecting.
Thank you. And going into the subject of COVID testing, that's one of the main ways that we can find out if we do have COVID or not, besides looking at the symptoms. There's these different types of tests. We see PCR test, and then we see rapid test. Can you explain or go into a little bit of depth of what's the difference besides kind of the wait time and the whole process behind it?
Yeah, so PCR test is the one that's going to be probably the best, because it's looking for, in a very, very accurate way, remnants of the nucleic acids. So like the mRNA, DNA, what we're talking, the nucleic acid, it's looking for that piece and then amplifying it. So you're like, oh, I barely found one strand or two strands or three strands, but now I can make like millions of copies by this mechanism called PCR. Very fascinating, revolutionary technology. Y'all should definitely look it up and read into it. But it amplifies what it finds. So that takes a while, right? Like amplifying takes a while. It's a cycle system. So it's going to wait a couple of days in order for you to get your results. The antigen test, through the way of, like, how you swab it, it's looking for certain proteins. It's looking for certain aspects of the virus that then travel in through like this maze. And then if it actually meets where like enough space, if it's like a perfect fit, it's like, boom, here's this extra line, right? It changes the color of the stuff there. But that protein could be definitely, it's not as sensitive as finding those just one or two copies that you can then amplify with that PCR. So if you don't have a lot of virus, then there's not going to be enough to pass through this little paper and make that line change color. which is not necessarily true for the PCR. That's why we say, hey, if you really want to know, go get your PCR. And it's also why you can spend ultimately like a month out and still be positive.
Thank you. Thank you, Dr. Gonzalez, for explaining, the difference between PCR and rapid test. I know there's a lot of questions around that, and people are always asking us, what's the difference? What's the whole process? So thank you for giving that information to the people on this Zoom and watching. So yeah, we want to thank you for your time, for volunteering your time, not only for being an essential worker, but for also taking the time out of your day and your job to provide this essential information that has so much impact and has so much potential to save lives and to keep people healthy. And before we close it out, we want to mention that we will continue to have these town halls with doctors. Next week, we're having one with a pediatrician, and we know that Zoom and town hall will be in Spanish. So yeah, before we close out, Dr. Gonzalez, do you have any a last message, any last advice, or anything you want to emphasize before we close it out?
Yeah, I would say, first of all, everyone out there that's ever had a thought of being a doctor, really chase your dreams. If you want to be in the healthcare profession, mentorship is incredibly important. Look me up, Dr. Lorenzo Antonio Gonzalez. You can find my name. I'll be more than happy to talk to anybody who's out there really looking in this field, because we need more folks. We need more people that are coming out of the community, because those are the folks that are really going to go back and make an impact. And I'm here. I'm here for Latino Health Access whenever they need me. Secondly, in regards to COVID, we have the power to make this stop today, right? Like, we have the power to halt this virus now. And that cannot be understated. This is controllable if we get everyone vaccinated around the world, global effort, which we've been able to do global efforts. We have that capability. So do not underestimate. This is not a thing that doctors are going to take care of. This is not a thing that nurses are going to take care of. This is something that we have to empower ourselves and say, I have the power to really lift my part of this mission, right? And this mission is to make sure that we protect ourselves. We have to see each other's as a community. We have to see each other's that our impacts other people, not just ourselves. And we have to really make sure that we take that here, al corazón. And that's how we should be moving forward, because this is not an individual disease. This is a pandemic. This is at best an epidemic. And this is something that we see that it's most likely going to be in our near future. But I do believe there's going to be a world out there where we're going to have this well controlled, and it's becoming because we came together as a community in order to really put a stance and tell that virus that we will be protected. We believe in science, and we have the power within ourselves to do this.
Yeah, thank you. Thank you for sharing that, powerful message. And I want to mention again, thank you for taking the time out of your day to just be here and to share the information and to share your knowledge. It's very much appreciated, not only from the community, but from LHA. So yeah, thank you. Goodbye. That should be all. So goodbye, everyone. Have a good night.